lack of experience. You mentioned that. You've got the credentials, you've got the degree, but guess what? You have no work history. Your resume is blank. So, like, going into that interview, I know now as a leader, that's one of the first things I want to do. I don't care where you work. You could be, a boutique, McDonald's. That's fine. I just want to know that you have work ethic.
Hey, sis, and welcome back to Coffee Chats with Chime In. Sis, I am Rosalind, the host, and today I have Jillian Richmond, the Director of Clinical Programs, also an MT alum, and my sorority sister. Jillian, how are you doing today?
Hey, Soror. Thank you so much for having me.
Definitely, definitely. So, something that we, talk about on the platform is the importance of, sharing our career stories and talking about really how we got to where we are. So I am really excited for you to share more of how you became the director of clinical programs, and how you were really able to pivot quite a few times, kind of within your career story. So I'm going to go on ahead and turn the floor over to you. Tell us more about how you got here.
Absolutely. Well, thank you again. So I knew from the beginning that I wanted to be in healthcare. Originally, I thought I wanted to be a bedside nurse. Found out very quickly, getting closer towards graduation, that was not the place for me. I knew that healthcare was something that was, never going to go out of way, never going to go out of business, something that made a huge impact on people's lives all across the world. And so it was really interesting trying to figure out, okay, if you're not doing it in the traditional or clinical sense, what can that look like for you? And so I switched over to healthcare administration, and a lot of the exposure that I had to healthcare was in doctor's office settings. So that was where I got my very first role in learning how a healthcare business operated, what the terminology was like, what a patient and a doctor's day in the life was like. And in that, saw so many different avenues that exist, to be able to make an impact in people's lives, which was ultimately my goal. And
Yeah.
so after starting in that setting, was able to then pivot, as you mentioned, into the corporate space. And
Yes.
so in that, it was, doing training. And that's where I figured out that I love training and education. So helping people again with, learning new information, whether it was a clinical process, whether it was technology that clinicians use when they're taking care of patients. And so did really well in that, enjoyed, working across large teams and, the relationships that came with that space. And so thankfully was able to continue promoting in that arena. And
Yes.
so from the education space, realized that I also really liked operations. And so when you think about
Mhm.
operations from a healthcare perspective, that's essentially keeping the wheels of the business bus going. So,
Mm.
helping staff feel like they have what they need to be successful, helping leadership teams, with crucial and critical information, processes that have to be created so that doctors and nurses know exactly what it is that they need to do every day. And so within that, it really kind of organically set me up for the role that I have now as a director of clinical programs, which is working across a large healthcare organization and really making sure that our teams have what they need to be successful to take care of our patients every day, whether that is hosting meetings and trainings and working with their leadership teams to help make their lives easier so
Yeah.
that they can do what they need to do to take care of those patients. And all of us at the corporate office, we are focused on making sure the nurses in the field and the doctors in the field have what they need and know who to call, if there's an issue stopping them from doing their job.
Awesome. You did a great job of outlining like what your job role entails,
Mm-hmm.
as well as talking about your journey. One thing that I think about, like when I think about healthcare,
Mm-hmm.
I go directly to like doctors and nurses and think about like the certifications and degrees that they have to have. So, what types of certifications and also education did you have to even be in this role and to move up the way that you have?
That's a great question. Because I'm not a clinician, like you mentioned, and I don't have to have those specific skill sets, really a lot of what I'm doing is more process driven and business driven. So the good thing about it is really getting that baseline of, I would say, business administration,
Yeah.
learning again how a business operates regardless to what setting you're in, which is great. So if you do want
Hmm.
to make a career change, you can do that because process and organization and project management and a lot of the skills that I use every day come in
Hmm.
different packages from an education standpoint. Now, I'll say that I did decide to get my master's degree in leadership and management because, again, once I got the foundation of how to run a business, I also really enjoyed the mentorship of working with other people and leading teams. And that has helped me, across this business. And guess what? If tomorrow I decide healthcare is not really where I want to be anymore, I want to go somewhere else, those degrees and those skills are going to go with me and translate very well, which is nice.
Yes, definitely. And that leads me to another question. So when you chose your career path, or even your degree, what you wanted to focus in, when you for your degrees, did you think about the versatility, or what did was it just like, oh, I want to do this, and then you found out that it was versatile afterwards? Was that a consideration beforehand
Yeah,
or
great question. I would say I knew that it was versatile because, again, when we think about healthcare, a lot of it's not just the nurses and the doctors. There
yeah.
is so much opportunity. You have hospitals, you have doctors' offices. Now, after COVID, you've got this virtual care space that, is
Mm,
exploding. You've got urgent care. There is so many different areas that you can focus in. You've got people in billing. You've got, I mean, just all this
mm,
different things. So, I mean, yes, that was definitely something that I knew going in just because I knew people that had all different jobs and, had that exposure. I think it was more of figuring out, man, where do I want to be? Like, where do I fit into all of this? And the excitement with knowing that over time, that journey may shift and
yeah.
it's all good. You can do that. You can switch it up after a couple of years, which is nice.
Definitely, definitely. Something else that I want to talk about, that's connected. You spoke about in our coffee chat how you were able to take advantage of getting experience while you were also in school.
Hmm.
So let's talk more about that, because I think that that's a huge um I feel like it's a topic that should be talked about a little bit more. Like, we get all these degrees, and then we get out
Sure.
here, and then for some of us, there aren't, opportunities for us just based on the degrees that we have. Sometimes we
Hmm.
need that experience. So tell us more about even why you took that step to get that experience while you were getting your degree, and then maybe we can have just a little bit more of a conversation, based upon that.
Absolutely. I'll be honest with you, Rosalind. There's two pieces to it. Transparently, I was financially independent. I didn't have parents supporting me, family members, to help with bills or even just things I wanted to do with my friends. So on one side, it was survival, right?
Mm,
It was, figuring out how to eat and how to do things that I enjoyed doing. On the other side, it was also hearing that there was struggle with new grads and this lack of experience. You mentioned
mm,
that. You've got the credentials, you've got the degree, but guess what? You have no work history. Your
yeah.
resume is blank. So, like, going into that interview, I know now as a leader, that's one of the first things I want to do. I don't care where you worked. It could be, a boutique, McDonald's, that's fine. I just want to know that you have work ethic, you've been responsible, for some
Mm,
type of process or something like that. And so it was very important for me to start building that muscle so that not only when I graduated, I had something to show for it and hopefully could, very easily or a lot quicker walk into a role, but also I wanted to be paid accordingly. I
yeah.
didn't want to be
Yeah.
lowballed or, have to wait 5 years or whatever the case is to receive money to take care of myself. I wanted to be able to set myself apart early, and thankfully that ended up playing out in my favor. Did I
Yeah.
miss some things socially and some experiences that you think about wanting to enjoy in college? Yes, but in the grand scheme, do I feel like a lot of it was worth it now? And I'm doing maybe some of the things I missed, back then now. Yeah.
Yes.
So I would
Mm,
say if find the balance, a couple hours a
mm.
week, get the internship, do something part time if you can, because it's going to make a huge difference to your employers and future employers to have that.
Yes, that is so awesome that you say that, and even highlighting, internships and things like that, trying to take advantage of those opportunities. So when you decided to take that route and get that experience, like how did you even know about those opportunities? Because I know sometimes like I've had even people in my family that have been like, I don't really know where to find an internship
Hmm.
or how to go out and get the job. So how were you able to, get that role or get that knowledge? Like where did that come from?
Yeah, and that's another good point because there wasn't a lot of resources at that time. I feel like to do so, which was one of the things that made that tough during that time. I want to say, if I think hard about that first opportunity in that very first doctor's office, I think it was on Indeed. I think I had heard of Indeed. The site where you can go and look for jobs based on your location. You can type in keywords, and I just started applying. Gosh, I would probably cringe to see what that resume looked like because I don't even think I had one. I think when they asked, I had to throw something together. But I think that, yeah, I think I just went on there and I didn't know what I was looking for. You
Mhm,
mentioned that. Like,
mhm.
you don't have to have all of the answers. I think sometimes we complicate things and think we have to have it all figured out and every piece, plugged in and all of that. I think I may have just started typing in keywords and then I started seeing trends in jobs and roles. And then that's what helps you figure out, okay, this is the type of role and this is the title that goes with it most often. And then it helps you make that job search a little more focused as you go.
Yeah.